Atrial flutter. So atrial flutter is one large ectopic focus re-entry circuit in the right atrium. Now your atrial rate is going to be between 200 and 350 times per minute, and the atrium are forming flutter waves or F waves. And these F waves are going to be the same size and shape, and it's going to be regular. The ventricular rate is going to be due to the gatekeeper, right? So how many times is the AV node allowing this conduction to occur? That's going to be your ventricular rate. The P waves, there are no P waves, there are flutter waves or F waves. The PR interval, there is none. QRS complex, generally narrow unless there's some aberrancy, which is going to widen that QRS. Now your ratio, we don't have a P to QRS ratio, we have an F to QRS ratio. A 2-to-1 ratio, something that quick, is generally going to be uncontrolled, whereas 4-to-1, 6-to-1, and even an irregular ratio is generally going to be controlled by medications such as beta blocker or calcium channel blocker. Now overall, the rhythm is regular or irregular, just depending on what the AV node is doing. So when analyzing atrial flutter, sometimes it can be confused with SVT, especially if you have something very quick like a 2-to-1 ratio. So in that case, what you can do is you can have your patient bear down, and when they bear down, it's going to slow that conduction from a 2-to-1, let's just say, to a 4-to-1. And then now you can more easily distinguish the flutter waves. Flutter waves create that sawtooth-like pattern. Sometimes it can be superimposed on the QRS, so it looks like the QRS could be lifting on one side or the other.